Today we're working with a 67-year-old patient with a left hip fracture. So to begin with, we want to choose the assistive device of a rolling walker. And we're going to choose this because it will give the patient increased stability and allow them to be partial weight bearing or weight bearing as tolerated on their left side to kind of take some of the force off of that left hip. And to begin with, we'll work on fitting the walker to the patient. So what you'll want is to have the handles to be right at the crease of the wrist, like this, and have a slight bend in the elbow. And if you do need to adjust the walker, it's easiest to flip it over, and you can just push in these little buttons here and pull or push up the legs as needed. And then for transporting the walker, you can just press down on these little buttons as so, and they bend in like this. And you can just press back down on them to fold them back out, and that's just easier to transport it and to store the walker. And then from here, I'm going to show you how the correct way to walk with a walker. So we would choose a modified 3-point gait. So on the left side, which is the side where the patient has the left hip fracture, they're going to be weight bearing as tolerated. So they can put as much weight as they feel comfortable through that left leg. So to begin with, you'll have both hands on the handles, and you're going to move the walker forward, and then stepping forward with that left affected leg, and bearing weight through your hands into the walker, and then stepping forward. And you'll continue that forward with the walker, left affected leg, and then step forward. And then now from here, if we want to turn around, you want to just slowly do small movements towards your right unaffected side. And we want to just make sure that we're not twisting any bit of the lower leg. So you'll pick up the walker and turn your foot, and then go ahead and come back. So walker forward, affected side, bear weight with your hands, and then step forward with the unaffected leg. Again, turn it around. Alright, and now I'm going to go ahead and hand it off to my partner Kailee, who will show us how to go from sit to stand out from the wheelchair.
Okay, so just as Ashley demonstrated how to use the walker and walk and turn, we would have done that with the patient as well. She was sitting here, she could see, but that would have been direct patient instruction so that when they get up that they're ready to be able to just get walking. So the first thing we're going to want to do is ensure patient safety. So we're going to use what's called a gait belt. This just basically gives us something to hold on to whenever we're walking with the patient, and just be able to provide support around their waist instead of just clothing. So I'll ask the patient to lean forward as much as they can and get this around. And if you come up closer here, you can see that there's one edge that has teeth. We're going to slide this through the edge that has teeth and get it pretty tight. Not uncomfortable for the patient, but it will loosen up a little bit as they stand up. So we want it pretty snug. That's just going to grip. And then we'll put the excess in there so they're not getting that caught on anything. And so typically we'd also demonstrate a sit to stand for the patient, but for the purpose of this video, we'll just explain it before the patient does it and as they're doing it as well. So I would just ask Sarah to scoot forward using her arms in her wheelchair to the edge of her wheelchair seat and put her arms back on the armrest as she has right now. And to guard her, I would have my hand underneath the back of her gait belt and right in front of her shoulder on her affected side. This is the most important guarding, and then we're also going to have a second assistant who will be guarding on the opposite side, again pulling up and helping her lift with the back of the gait belt and just kind of being there for support in case of any instability. So I'm going to have her push through her arms and stand up on the count of 3, and then we're going to reach for this walker. And again, it's really important when you're helping the patient get up to use good body mechanics, so keeping your back straight and your knees bent, lifting through your knees. So on the count of 3, Sarah, we're going to have you lift, okay? 1, 2, 3, push up and grab that walker. And then again, I would be guarding in front of her shoulder and on her back, and Ashley can kind of just stand to the side in case of any instability. And we're going to go ahead and do that modified 3-point gait, Sarah. So you're going to push forward with the walker, bring your left foot forward, and bear down through your arms. Perfect. Again. Good job. One more step, and then we'll turn. And she's just gonna take those tiny steps, again, avoiding any twisting of the lower limbs. And we turn towards that right side, because that's her good side, like Ashley said. And turn towards the right again. And then to back up to the wheelchair, they would just bring their feet back. Have them reach back for the armrest one at a time and slowly sit down. Did we miss anything?